Dr. Hanafi bin Hussein, the course coordinator of AIX 3001, yang berusaha Profesor Madya Datin Dr. Safia, the supervisor of our group, which is Group 1, We Care, our respected line of panelists, Professor Madya Dr. Mohsin, and Mr. Kenny Lim, respected lecturers, and my group members, as well as the audience. Good morning, everyone. So, before we go any further, I would like to remind that we are also streaming on YouTube, on our channel, as well as our Facebook. So I'd like to welcome all of you. Hello, good morning. I hope everyone is well. I'd like to introduce ourselves. We are Group 1, aka We Care, and we are a group formed for our compulsory faculty course AIX 3001, Ethics and Professionalism in Social Sciences. Our event for today is entitled Sanity Check, Mental Health Management Against COVID-19. And just like the name of our event, we will try our best to tackle the importance of managing our mental health amidst the COVID-19 outbreak with our two honorable panel guests. This program is in joint ventures with WAPTv.Malaysia, Dreamers Training Group, Youth Build Nation, KM FSSS, PKPIM UM, and Harmoni UM. Thank you so much for supporting us and willing to collaborate with us. A reminder to switch off your cameras and mute your microphones. Thank you. Now, let us bless our event by reciting Surah Al-Fatihah. Al-Fatihah. Amin, amin. Baiklah. First and foremost, I would like to call upon Professor Madya Datin Dr. Safia binti Muhammad Yusof to give us a short speech. Silakan Datin.
Okey, terima kasih Cik Alia. Assalamualaikum warahmatullahi taala wabarakatuh dan selamat pagi. Bismillahirrahmanirrahim. Pertama sekali kita mengucapkan syukur kehadirat Allah Subhanahu Wa Taala kerana izin dan limpah kurnianya dapat kita bertemu pagi ini walaupun di alam maya dan menggunakan Google Meet, dan pada masa yang sama saya difahamkan di YouTube juga kita adakan streaming. Jadi kita bersyukur kerana kita harap pelaksanaan program kita pagi ini akan terus berjalan lancar sehingga ke akhirnya. Dan kita bersyukur, saya juga bersyukur kerana dapat hadir pagi ini untuk menyampaikan sedikitlah sepatah dua kata ataupun seminit dua kata pada dalam program hari ini. Dan pertama sekali saya nak mengucapkan selamat datang kepada semua yang hadir. Saya lihat sekarang ni ada lebih kurang 76 partisipan dan saya ingin mengucapkan selamat datang ke program Sanity Check, Mental Health Management Against COVID-19. Saya sebagai penyelia kumpulan ini ataupun juga dikenali sebagai kumpulan We Care. Kalau semua peserta dapat lihat simbol dia warna merah supaya nampak dan ada perkataan We Care. So this is group ini, dan kita juga ingin mengucapkan ribuan terima kasih kepada semua yang sudi menonton pada pagi ini. Dan saya difahamkan ada beberapa pensyarah yang juga hadir dalam program ni. Profesor Madya Dr. Hanafi Hussein yang memang sentiasa memberikan sokongan kemudian kepada beberapa pensyarah lain, juga kepada jemputan kita Encik Kenny Lim, pengarah eksekutif Befrienders KL. Untuk makluman Encik Kenny, ini bukan pertama kali kita bekerjasama dalam kursus ini. Sebelum ini pun kita ada wakil dari Befrienders yang yang turut terlibat dalam program AIX 3001 ni. Ini adalah khusus AIX 3001, etika dan profesionalisme dalam sains sosial, yang perlu wajib diambil oleh semua pelajar Fakulti Sastra dan Sains Sosial, kerana ianya adalah khusus wajib fakulti, teras fakulti. Dan mereka dikendaki untuk mengadakan event lah, dan juga kepada Profesor Madya Dr. Muhammad Musin Ahmad Zahari, konsultan dalam bidang psikiatri di UMMC. Kita juga mengalu-alukan semualah yang hadir ke program kita pada pagi ini. Sebelum itu saya juga ingin mengucapkan terima kasih kepada WAPTv.Malaysia, Dreamers Training Group, Youth Build Nation, KPIM Fakulti Sastra dan Sains Sosial, Persatuan Mahasiswa, PKPIM UM dan Harmoni UM kerana sudi untuk bekerjasama dan berkolaborasi dengan We.Care untuk menjayakan program kita pagi ini. Program ini kita wujudkan bertujuan untuk membincangkan kepentingan pengurusan kesihatan mental, untuk mengetahui cara-cara untuk menangani isu kesihatan mental dan dalam menangani wabak COVID-19 yang melanda negara kita sejak daripada bulan Februari yang lepas. Dan kita juga tahu bahawa penjagaan kesihatan mental ni sangat penting, sama pentingnya dengan penjagaan kesihatan fizikal. In fact, kalau kita tengok sekarang ni, penjagaan kesihatan mental ni semakin menjadi penting dan ketara, kerana terutama sekali bila ramai yang tak dapat keluar, semuanya terperap di dalam rumah. Perbincangan seperti ini adalah menarik dan baik untuk membuka mata serta minda supaya kita dapat membuang segala stigma terhadap masalah kesihatan mental kita. Jadi saya harapkan kita tidak memandang ringan masalah kesihatan mental ni, dan jangan berasa rendah diri dan mencikkan diri. Ia bukanlah sesuatu perkara yang yang sesuatu yang tidak baik, sebab perkara itu perlu kita tangani, bukan kita biarkan. Akhir sekali saya ingin mengucapkan syabas dan setinggi penghargaan kepada jawatankuasa, iaitu kumpulan ini sendiri, kumpulan We.Care, yang saya tahu telah bertungkus lumus memikirkan, brainstorming, merancang, menyediakan sehingga tengah malam, dan harapan untuk menjayakan program ini. Dan harapan saya agar kita semua dapat memanfaatkan sebaiknya bincangan kita pada hari insya-Allah. Semoga program ini dapat berlangsung dengan jayanya, dan saya akhiri dengan wabillahi taufiq wal hidayah. Assalamualaikum warahmatullahi taala wabarakatuh. Terima kasih.
Terima kasih Datin. Okay, now I would like to call upon our director, Daniel Dasris, to give a short speech. Daniel?
Okay, baik. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh. And a very good morning I wish you all. Salam Sanity chat. First of all, I would like to thank you, Nandre, We.Care, Sukar. Terima kasih, especially pertama-tamanya untuk tim saya We.Care atas usaha, tenaga, kerjasama yang diberikan bersama. Yang pada hari ini kita dapat lihat event kita alhamdulillah berjaya seperti yang dirancang, dan moga-moga sehingga ke akhir event kita nanti kita akan lihat hasilnya dan berjaya seperti yang berjaya dengan jayanya. Seterusnya kepada Profesor, kepada Dr. Harafi, Datin Safiah, barisan panelis jemputan, Profesor Madya, Dr. Muhammad Musim, dan juga Mr. Kenny Lim. Thank you so much for accepting our invitation letter. We appreciate it very much. Dan juga pada beberapa pensyarah UM yang lain yang saya difahamkan turut serta menerima jemputan kita, iaitu Dr. Syahidah, sekiranya ada. Hai Doktor. Okey, baik. So tak dilupakan juga kepada badan-badan organisasi NGO, badan-badan pelajar seperti WAPTv.Malaysia, Dreamers Training Group, Youth Nation, YBN, PKPIM UM, KMUM, Satuan Mahasiswa, Fakulti Sastra dan juga Harmoni UM. Terima kasih kerana sudi menjadi salah satu komponen penggerak untuk bersama menjadikan program kita pada kali ini, dan juga penonton-penonton, sidang hadirin dan sekali yang sudi meluangkan masa bersama. Selamat datang saya ucapkan. Baik, saya go straight kepada harapan, hope saya. Yang pertama, saya berharap ini merupakan our hopes together. Saya berharap agar program yang dijalankan ini dapat menjadi salah satu pemangkin semangat, motivasi bersama. Wa imma bukan kita sekalipun, kita dapat berkongsi manfaat dan ilmu yang diharapkan dapat dicurahkan kepada orang lain juga. Dan seterusnya saya berharap agar sepanjang program ini berlangsung, talk-talk yang diberikan kepada daripada panelis jemputan ini dapat dirancangkan lagi dengan sesi soal jawab yang kemudiannya sama-sama kita akan dapat ilmu yang berguna dan ilmu yang baru, insyaAllah. Baik, sekian itu sahaja daripada saya. And the stigma, reach out, save yourself, save us. Wabillahi taufiq wal hidayah. Assalamualaikum warahmatullahi taala wabarakatuh, and have a nice program today. Thank you.
Baik, terima kasih saudara Daniel. Untuk pengetahuan penonton, event ini akan dikendalikan dalam dua bahasa, bahasa Melayu dan bahasa Inggeris. Now next, we would like to show a promotion video that we filmed last week to promote our event, and it was actually edited by our lovely director, Encik Daniel. So take it away, Michelle. Okay, thank you so much, Michelle. Now on to our main event. I would like to introduce our honorable speakers. Hello, please welcome firstly Mr. Kenny Lim, who is the Executive Director of Befrienders KL, a non-profit organization that provides emotional support 24 hours a day, 7 days per week without charge. Welcome, Mr. Kenny Lim. Thank you for being with us. And I would also like to welcome our second panel guest, which is Associate Professor Dr. Musin bin Ahmad Zahari, a consultant in psychiatry in University Malaya Medical Center. Thank you so much for joining us as well.
You're welcome.
And may I ask the panel guests to introduce yourself and to tell us a bit of your background. We'll start with Prof.
Oh, myself.
Yes.
A very good morning. It's good. Good morning to everyone because today is our last day for the PKPB or conditional MCO. So tomorrow we will have another phase of the MCO. Anyway, it is very important. Thank you to We.Care for inviting me as well to this program. So I'm actually working in UMMC as a consultant psychiatrist, and I'm dealing with patient with stress, with mental problem and mental illness every day. Run a clinic here as well, and my research quite a variety from hospital-based and also seeing people with addiction problems. Many type of addiction we have now. People like probably glued to gadget because now we promoting everything through online like this. So anyway, yeah, I'm happy to be here to answer whatever question being posed to me and try to share what the knowledge that I have, with everyone here. Thank you very much. Yeah.
Okay, thank you, Prof. Now, Mr. Kenny, can you
Thank
introduce yourself?
you. Thank you. Very good morning to every one of you. As you know, my name is Kenny and I am actually with the Befrienders KL. I joined about 20 years ago as a volunteer, and I've been with them as a volunteer for 20 over years. And about 5 to 6 years ago, I joined as an admin staff. So basically, a big part of my life is involved with the Befrienders KL. So a quick introduction of the organization. Yeah, Befrienders KL is a not-profit organization that offers emotional support to people who are feeling depressed, who are feeling suicidal, and also basically to anyone who needs someone to talk to. They can get in touch with the Befrienders. At the moment, during this MCO, CMCO, and now is, I don't know what MCO is, that recovery, yeah? RMCO, yeah? So we are on telephone 24 hours now, which something that we have been doing as well. It's just that previously we were offering face-to-face as well. So right now there's no face-to-face, but we are still on phone 24 hours. And we also do a lot of outreach work to create awareness on issues related to suicide prevention. That's where our focus is, yeah, and also on mental health issues, basically to create awareness, to reduce the stigma, yeah, so that people can have more understanding of what suicide is about, what mental illness is about, yeah. Thank you. So basically that's it. Can ask more questions later on, yeah.
Okay,
Yeah.
thank you, Mr. Lim. Before we start the whole discussion, I would also like to announce the winners for our video contest. For your information, we had a video contest which was open to everyone to join, and after careful consideration by our members, we thought of giving consolidation prizes as well as the prizes of the top three. So the person who will get the consolidation prize is at Pop D. Congratulations. And now for the top three videos, I would like to announce from third place, third place is Azmuddin 27. Congrats. And second place is at Faiz Matnor. Congratulations. And finally, the champion for the video contest is A.M. Mukni, or as his classmates or people who know him as Abdul. So congratulations. Now, of course, we cannot just go on without watching the video. So, Michelle, we'd like to share Abdul's video, and you will see why he is the champion. Just a reminder, everyone, to mute your mics and switch off your cameras. Thank you. Michelle?
Bila sang tertanya-tanya juga apa itu maksud kehidupan dalam aku mula
And to curb the spread of the coronavirus outbreak, we are forced to take preventive measures so on, such as staying at home, avoiding physical contact. Hari tu masa hari raya kita tak boleh salam pun saudara mara kita ya. And we also have to practice social distancing, so on and so forth. We didn't have much time to prepare or to process what's to come because everything happens so abruptly. Thus, many are actually struggling financially and mentally to cope with the sudden changes, such as attending classes from home, like we are doing right now, working from home, and so many others. These sudden changes in routine will take a toll on our mental health. And let's start with a statement made by the Health Director General, our Datuk Sri Dr. Nur Hisham Abdullah, who we see every 4 o'clock, 5 o'clock in the evening. He stated that around 8,380 calls were recorded on the COVID-19 hotline since the early days of MCO. And this takes about 46.8% of the calls and were linked to emotional problems or an instability in mental health management, such as stress, anxiety, and even difficulties in managing anger. This anger could have been caused by social factors such as financial uncertainty, misunderstanding amongst peers, and anxiety and stress from getting infected. It is believed that the numbers of calls regarding mental health issues are on the rise and will still be on the rise even after MCO is finished. Baiklah. I would like to start round 1 of our forum. I'd like to invite Professor Madya, Dr. Musim. I'd like to start with some questions. Okay. Prof? Unmute. Tak dengar.
Yes.
Okay.
Sorry. Because sometimes using Zoom, sometimes using Google Meet, and the team, Microsoft Teams. So anyway, about mental health, I think it is very important. I mean, in the past 3 months, it's also obvious that our society, has changed. So I think I will use both language, right? Bahasa and English. So sebab kalau dah biasa bercakap English je lah. So anyway, kita menyesuaikan diri, masyarakat kita suddenly, in other words, macam diserang lah. Macam berperang, diserang oleh COVID-19 ni. Dan COVID-19 ni adalah satu virus yang memang kita tak nampak. Saya berjumpa dengan orang umur 60 tahun, dia kata pakcik seumur hidup pun tak pernah kena macam ini. Perang dunia je ada saya jumpa dengan satu orang umur 90 macam tu kan. Jadi tapi dia kata sekarang ni macam virus ni dah satu threat lah, ataupun ancaman kepada masyarakat. Tapi itu ancaman, walaupun virus tu tak nampak, saya kata penyakit fizikal yang diancam, maksudnya dia attack our breathing system semua tu, tetapi secara tak langsung dia menyerang juga mental manusia sejagat ni kan, di mana kita punya emotional well-being kita punya kognitif kita has been attacked by the threat of this virus kan. Jadi menyebabkan kita menjadi risau, bimbang. Itu memang ada pada peringkat mulanya sebab kita tak tahu something unknown to the people. Setakat mana virus ni akan menyerang kita. Itulah sebab itu benda ni bermula pada Disember, tetapi bila masuk bulan Februari kita nampak benda ni ataupun perkara ni dah menjadi lebih serius. Dan di situ yang kalau secara normal respon pun kita ada risau. Kalau bertindak balas, maksudnya macam mana kita nak ambil serius terhadap masalah ni, kita mungkin tidak ambil kisah. Itu kita lihat kadang-kadang yang terlalu ekstrim yang tak kisah, contohnya dalam public kita perlu pakai mask contohnya. Dan juga kita kena ada social distancing. Sebenarnya perkataan social distancing saya selalu kata bukan perkataan yang tepat lah. Sebenarnya physical distancing itu sebenarnya, maknanya dari segi fizikal tu penjarakan perlu ada. Dan satu lagi yang selalu diperkatakan tu, kalau kita berada dalam tempat closed space ataupun confined space with another person. So ini je sebenarnya elemen kenapa kita ada MCO di peringkat awal. Dan kalau semua memahami, insyaAllah saya rasa kita boleh menyesuaikan diri, kita lebih positif untuk berdepan dengan cabaran virus yang kita tak tahu ini. Dan sekarang ni kita dah mula memahami karakter ataupun pelakuan virus inilah. Jadi sebab itu kita akan, kerajaan telah longgarkan sikit-sikit MCO itu. Jadi masalah tekanan itu bila kita tak tahu akan menjadi lebih serius. Dan pada peringkat awal atau pada amnya pun ramai orang memang ada kerisauan yang pada masa itu saya rasa, ataupun sehingga sekarang pun kita tidak boleh leka bila kita pergi ke tempat awam, kita kena berjaga-jaga. Jadi ini menyebabkan stres pada diri kita juga. Jadi macam kita kata relaxation teknik bila kita risau tu mungkin membantu. Dan perkara ataupun bila kita menyesuaikan diri, terapi relaksasi ni kita kena amalkan lah, maknanya amalkan, kita biasakan bila kita risau dan sebagainya. Selain daripada itu, satu kumpulan lagi contohnya mereka yang memang ada mungkin ada masalah kesihatan mental lah, macam ada kemurungan, ada kerisauan. Dengan kejadian ini, dengan COVID ini menjadikan masalah tu lebih kronik dan lebih teruk lah. Dan ini kadang-kadang satu level ini yang di mana bantuan tu kena diberi lebih lebih kerap ataupun lebih close with the patient. Macam saya ni memang merawat, jadi saya kalau yang mana keadaan yang lebih teruk, walaupun di PPM ni pada dasarnya masa COVID menyerang hari tu sehingga bulan Mei hari tu, kelihatan lawatan pesakit contohnya ialah hospital bukan tempat yang terbaik untuk berkumpul, tetapi ada mereka yang masih memerlukan rawatan. Saya kata lebih datang 2 minggu sekali, seminggu sekali pun ada. Jadi ini kepada mereka yang memang dah ada masalah lah. Dan ini bantuan yang kita beri ni, alhamdulillah dia dapat mengurangkan seseorang tu menjadi lebih, orang kata lebih teruk lagi keadaannya. Dan satu lagi yang saya rasa saya nak kongsi di sini, satu golongan lagi adalah saya kerja di hospital. So frontliners ni, frontliners pun saja saya share di sinilah. Banyak juga yang stres sebab frontliners ini mereka berdepan dengan orang yang datang yang ada simptom batuk, sesama, demam dan sebagainya. Dan golongan ini lebih dari segi kesihatan mental lebih mereka bimbang, adakah mereka akan dapat, adakah mereka akan membawa balik virus ini. Itu satu berkenaan dengan virus. Kerja pula sebab hospital di bahagian kecemasan lebih, orang kata kerja lebih keras lagi. Kan doktor dah terjumpa dengan ini, sekarang dengan yang ada positif ataupun yang ada suspek ni, dia pula kena kuarantin, tak cukup orang lain kena masuk lagi. Jadi keadaan di hospital tu menjadi lebih kritikal daripada suasana pekerjaan dan suasana berdepan dengan COVID ini. Jadi ini semua cabaran juga dari segi saya sebagai profesional dalam kesihatan mental ni di PPM. Itu setakat ini saya boleh share lah. Selalu boleh tanya lagi.
Jadi frontliners akan datang juga kepada klinik psikiatri untuk dapatkan rawatan.
Ya, memang kita buka, kita ada buat kita di hospital ni, kami pun ada buat sesi town hall macam ni lah setiap minggu, malah dua kali seminggu pada masa bulan Mac dan bulan April. Dan kita istilahkan PFA, Psychological First Aid. Psychological First Aid ni adalah bantuan awal untuk mereka yang ada kerunsingan, kerisauan berkaitan dengan disaster. So kita anggap virus ni pun macam disaster lah, walaupun disaster ni bukan earthquake, bukan banjir besar, tetapi nyawa juga dia boleh ancam. Yang duduk di hospital frontliners ni sentiasa, orang kata sentiasa terancam lah, dan rasa takut tu sentiasa ada. Okay.
Nak tanya juga, mental health ni ada banyak stigma. There are lots of discrimination. That's why tak ada orang yang nak reach out to experts because they think that they're not sick, or if they acknowledge that they're sick, they will think, alamak, tai gila ke? Gitu kan? So how do we overcome that stigma?
Yeah, it's not a simple answer lah. Basically, I know, because stigma has been existed for long time, dan it's different between one society to another. Contohnya dalam masyarakat kita ni kuatlah juga di Asia ni khususnya, banding dengan di barat memang ada stigma tetapi berkurangan. Dan masalah sekarang ni bila kita lihat stigma ni, cara amnya kita boleh lihat punca stigma itu. Jadi overall stigma tu kita boleh kata macam external stigma, maksudnya daripada masyarakat. Yalah, masyarakat kadang-kadang ada prejudis lah, ada membuat diskriminasi. Contohnya kalau kerja, dia tak nak, kalau sebut ada penyakit, kita declare ada kemurungan pun. Kemurungan ni banyak orang ada, sebenarnya perkara biasa. Tetapi kalau jumpa dengan doktor psikiatri atau jumpa kaunselor, dia dah dilabel pula yang salah. Jadi dia akan mungkin hilang kerja dan sebagainya. Jadi stigma ini amat sukar lah nak orang kata nak ditangani secara efektif. Cuma usaha tu kena berterusan. Contohnya mungkin dengan kita berbincang macam ini pun satu usaha yang bagus, sebab memberi pengetahuan pada masyarakat at large secara keseluruhannya berkenaan dengan kesihatan mental ni. Memang kita menghadapi sentiasa, dan ada orang teruk, ada orang yang tak teruk. Contohnya bukan semua sama cara berdepan dengan masalah, sebab it depend on how we be our upbringing contohnya kan. Jadi banyak faktor-faktor lah. Kalau nak cerita macam nak counsel sini pun susah juga kan, tapi banyak faktor ni. Jadi benda ni sebenarnya kesihatan mental ni, gangguan kesihatan mental ada perkara biasa. Dan dalam life kita pun ada up and down. Kadang-kadang ada teruk dan kadang-kadang tak teruk. Jadi dan lain orang lain caranya. Jadi inilah di kadang-kadang tertentu di mana kita perlu lebih sensitif, di mana kita tidak melabelkan bila orang tu mendapat rawatan, dia dah ada penyakit G, astrik. Saya tak suka guna perkataan itu sebenarnya kan. Very sensitif, sebab dia menimbulkan rasa inferiority dan sebagainya. Jadi selain pada itu, mereka kerja dia diskriminasi tadi, prejudis contohnya. Yang ada ni memang kalau ada penyakit mental, dia tak boleh berfungsi, dia tak boleh bekerja, dia tak boleh mengajar kalau cikgu, dia lecturer, dia pula tak boleh nak buat sesuatu. Jadi stigma luaran ni akan masuk ke dalam diri individu tu lah. Jadi itu yang keduanya tadi, dia jadi self stigma lah. Self stigmatize ni maknanya stigma dari dalam orang itu sendiri. Jadi bila orang dah kata dia tak boleh semua, dia jadi low self esteem, dia dah rasa tidak ada keyakinan diri, dia rasa is a failure, is a character mistake, dia akan fikir macam itulah. Ini yang kalau nak tanya soalan tadi, bagaimana nak menghapuskan semua ini? Ini yang kesukarannya untuk dilakukan secara efektif. Tetapi jika kita bercampur dengan kumpulan yang betul, contohnya rakan-rakan yang positif, kita dapat rawatan ataupun kaunselor di peringkat awal untuk memberi keyakinan diri kita dan untuk mengelak masalah tu menjadi lebih serius, ditangani di peringkat awal. Selain daripada itu juga, kita boleh bercakap dengan seseorang yang kita rasa yakin lah, orang yang boleh mendengar dan sebagainya. Itu saya rasa antara step yang akan mengurangkan, sebab walaupun ada stigma di tempat kerja atau di kelas ke apa ke, tetapi bila kita jumpa kawan, dia akan neutralize balik perasaan-perasaan itu jika dilakukan secara berterusan lah. Jadi kalau kita bercakap tu, kita kena cari orang yang sedia mendengar dengan positif. Bukan kadang-kadang kita punya trend social media lah di peringkat college ni atau UST ni, suka kita letak dalam Facebook dan sebagainya. Jadi kalau kita throw problem in random to anyone in public, kadang-kadang kalau tak betul ni, dia akan menimbulkan stigma dan tekanan pada diri kita tu balik. Itu kena ingat, itu bukan metode yang membantu merungkaikan stigma ni. Jadi kita cakap dengan orang yang boleh mendengar, orang yang jadi pendengar yang baik. Jadi kita tak boleh judgemental, tak boleh terlalu menghakimi keadaan, sebab kita boleh kata kawan kita tu sama dengan keadaan kita juga, sebab cara dia dibesarkan, cara dia berfikir, cara dia menangani masalah yang dihadapi, semuanya berlainan. Jadi bila kita mendengar, macam saya kata tadi, konsep psychological first aid tu, kita mendengar dengan neutral. Kita mendengar, kita cuba memahami bagaimana rakan kita menghadapi. Jadi kita, istilah kami panggil empathy lah. Maknanya kita memahami seperti orang yang kita dengar tu, bukan seperti diri kita. Macam mana dia lalui, dia rasa dan sebagainya, dan kita kena neutral lah dekat situ, daripada jangan judgemental lah. Ini antara skill lah, saya dah share dekat sini, skill untuk menjadi satu pendengar yang baik kepada masalah rakan kita dan sebagainya.
Okay, terima kasih Prof. I'd like to shift our attention to Mr. Kenny Lim now. Mr. Lim?
Yeah, sure.
Yeah, hello. So I was informed that you would like to discuss about symptoms and signs of someone in distress. But first, I'd like to know how are you and your team coping during this MCO? Because I think there are lots of calls.
Yeah, thank you so much for the concern, because I think the focus is always on people who are struggling, but for caretakers, biasanya orang tak tanya lah how they are doing, right? So thank you so much. For us, I think we are coping okay, I would say. The thing is that at the beginning of the MCO, we were still able to operate from our center, which is in Jangan, nearby to UM, I think about 10 minutes drive away. But then the second phase of MCO, which started in April, 1st of April, we were not allowed to operate from the center. So that actually, that's when the anxiety kicks in, because we were, it was something new. We have always answered calls from our call center, which is a physical phone room with phones there, and the volunteers would go and pick up calls. So all of a sudden, when we were told we're not able to operate from the center, that was when we got a little bit anxious, like what would the arrangement be, how would we be able to continue providing the service to the public, because we realized that with the MCO, with people not being able to go out, they are confined in indoor for a long period of time. That was when a lot of people will be affected. So we realized that the emotional support service has to be there still, and for 24 hours. So in a very short period of time, we had some discussions, and we basically transitioned ourselves from phone calls to Skype at the beginning, because we wanted the service to still be available. We wanted people to be able to get in touch with us 24/7. So we went transitioned to Skype from the 1st of April onwards. But then we also realized after a few days of using Skype that not many people contacted us. We actually saw a dip in the number of calls that we received. So back to the drawing board again, we had to look for other ways and very, very fortunate, we managed to connect to someone who's able to support us, to sponsor us a system whereby the callers, people who are in distress, can still call a number, and then from that number, it's being diverted to our volunteers who's able to answer calls at their home. Yeah, so we are very thankful for that. The only catch is that we couldn't use the existing number. We use a new number. So that means a lot of publicity, a lot of awareness, telling people that we have changed our number. But then again, it is sort of like a blessing in disguise, because now we realize that it's so much more convenient that we are able to actually give service from our home, the comfort of our home. Yeah. So the reason why I'm sharing this short story is basically to tell everyone that in times of difficulties like this, where we are facing a lot of challenges, yeah, we will be able to sort of like see opportunities, and that we are able to basically discover that there are some maybe hidden capabilities or hidden skills that we have that we can use to solve problems. Yep. So in times like this, if we actually spend time to look into ourselves, to maybe like discuss with people around us, we will be surprised to see that what are the things that we can actually do. Yeah. So from then onwards, I think we started our phone again with a different number on the 10th of April. Until now, almost 2 months already, and we are still functioning. But having said that, nothing is perfect. Nothing is perfect. So every now and then there will be some issues that comes up, and we just have to find ways to solve it. So at the moment, we are receiving about 60 calls per day, which is not as many as the statistics that you shared earlier on, yeah, the Talian from KKM, yeah. I think they have been receiving more calls. I think for us, it's because of the limited numbers of volunteers on duty. Each time we have about 2 to 3 volunteers on duty only. So I think that actually makes it difficult for us to answer more calls, yeah. But I am actually quite glad that there are still people calling in, and callers do not actually talk for only 10-15 minutes. Yeah, some of our callers actually talk for up to an hour and a half. So yeah, we are doing okay now. Yeah.
So that's very good to hear. So I'd like to ask, what can people do if they find it hard to cope? Like, are there any signs that we have to look out for? Are there any signs of distress that we should look out for ourselves or people around us?
Okay, I think the first thing is that we need to be aware, we need to have that self-awareness of how we are feeling at the moment. A lot of times we are not in touch with our feelings, or we tend to push aside our feelings, especially feelings that's not very comfortable. For example, you know, with the beginning of the pandemic or MCO, there's a lot of people who's struggling with anxiety, with fear, because we don't know what's happening. As Prof. Musim mentioned earlier, a lot of us, or rather all of us, have never encountered such a situation before. It's something very new, very unknown. So we are afraid, we are anxious of the future, of what's going to happen, how long is this going to be, after everything ended, will I still be having my job, for example, how is my financial situation going to be, yeah? So in times like that, a lot of us are struggling with anxiety, with fear, with confusion. I think what's important for us to do is to be aware of our feelings, and then to be able to accept how we are feeling. If we are feeling fearful, for example, it's tell ourselves that it's okay. In the video, it says it's okay to not be okay, and that's true because we can't be okay all the time. There are times when we feel vulnerable. For example, there are times when we feel like I cannot handle this situation. It's okay, but the point here is that it's important for us to be aware of it and then acknowledge that this is happening, and then have self-compassion. Be compassionate to yourself. A lot of times we are compassionate to others, right? We are not so hard on others, but we are normally very hard on ourselves. Yeah. But I think it's important for us to also tell ourselves that, hey, it's okay to feel bad for a while. It's okay to feel sad for a while. Okay. Because if we don't acknowledge our own feelings, we will not be able to take the next step. For example, what do we do to manage our stress? What do we do to manage our sad feelings? Right? So that's very important, to be aware, to be self-compassionate to yourself, right? And then when you know that you're struggling, for example, symptoms or signs that tell us that we are struggling are right. Loss of interest in the things that we normally enjoy doing. And if we realize that there's changes in our sleeping patterns, for example, either we sleep a lot or we sleep not enough, okay, or changes to our eating behavior. We eat a lot, or some of us, or most of us can't actually eat. Yeah. For example, you feel tired all the time. You can't focus. You can't concentrate. For students, you know, you are doing online studies now. You find it difficult to concentrate. You're given assignment. You find that you can't actually complete your assignment. Also because there's a lot of distraction, maybe. So all these signs, including feelings of helplessness, you feel like, oh, I can't do anything in times like this. I'm actually confined. I can't even go out, right? Feelings of hopelessness. Also, in some cases, there may be suicidal thoughts. Yeah, there may be suicidal thoughts. So all these signs, if you realize it's happening to yourself, or you see people around you experiencing some of these signs, it means that you may need to intervene. You may need to reach out to this person. Or if you yourself going through all this struggling, right? It means that you may need to basically reach out to someone for help. It could be someone that you trust, a friend, a family members, or you can reach out to helpline like the befrienders, or seek professional help. Right. Apart from that, I think a lot of things that you can do are stay connected in times like this, especially if you're alone, yeah, and you're separated from your loved ones. With the technology nowadays, you can use your phone to do normal voice call, video calls. Basically, keep in touch with others. Also, show your concern to people that is struggling. Yeah, and as mentioned by Prof just now, relaxation technique, you do yoga, for example, breathing, you make sure that you eat healthy, you want to get active as well. Even at home, you can still do exercise. There's a lot of videos online nowadays that you can actually follow, right? And also, I think one thing that's very important, students especially, yeah, is to make sure that you get adequate enough rest and sleep. Okay, especially now you don't have to go to school, right? You spend a lot of times maybe on your phone, you know, playing games, social media. That's something that we need to control. Yeah, be aware that, you know, if I spend too much time on social media looking at all this depressing news, for example, when you feel overwhelmed, tell yourself that, hey, it's okay, I need to stop right now and do something which is more beneficial. Yeah. So another thing here is to be able to control yourself, right?
Okay, thank you, Mr. Lim.
You're welcome.
Just a reminder to our audience that we are taking questions here on this platform, Google Meet, as well as our streams on YouTube and Facebook. So please drop us a question. All right. I'd like to end round one. And so our speakers can have a short break. And during this break, I'd like to show the second place winner of the video contest, which is Faiz Matnoor's video. Another reminder, please mute your microphones and switch off your cameras. Thank you. Silakan, Misha.
Jadi Assalamualaikum warahmatullahi wabarakatuh. So aku macam nak tukar lah. Aku macam dicoba tu terlalu panjang dan aku rasa macam buang masa. Video lah pendek, nanti korang akan bosan kalau dicoba tu dah berlama. Korang rasa macam apa benda lah Mamat ni akan menyebok ni kan. So aku macam tukar. Assalamualaikum warahmatullahi wabarakatuh. Baiklah kawan-kawan semua, hari ni topik agak bosan lah ya. Tapi aku rasa aku kena cakap waktu benda ni. Walaupun aku rasa benda ni dah lama, dah semua orang pun dah cakap. Tapi aku rasa aku kena cakap juga. Sebab kalau aku rasa tak bercakap, aku rasa macam aku ada tanggungjawab yang aku tak buat. Jadi aku kena bercakap juga supaya orang pun tahu. Walaupun orang tak nak tahu sangat pun, tapi orang pun adalah orang tengok. Walaupun ada macam 100 orang tengok, seorang je yang terkesan, tak apa. Asalkan aku buat video ni. Okay? Topik kita pada hari ini adalah tentang kesihatan mental. Boring kan? Aku bukan doktor nak cakap pasal mental ni, tapi aku rasa aku kena cakap jugalah. Jadi pada hari ini aku akan bagi 4 cara untuk kita menjaga kesihatan mental during kawalan pergerakan inilah. Yang pertama adalah sentiasa berfikiran positif. Contohlah kita rasa macam, oh mungkin kalau aku kat rumah ni banyak lagi kebaikan yang aku ada. Dapat dengan keluarga, dapat dengan ini, dapat dengan itu. Kita cubakan buang pemikiran-pemikiran negatif walaupun benda tu betul. Contoh macam contoh macam kalau kat kelas kan senang kita nak refer kawan-kawan. Senang pergi bilik sebelah, pergi college lain, nak just naik motor lepak kat McD 24 jam. Tapi kat rumah tak lepas nak lepak macam tu kan. Memanglah tak ada nak buat apa, tapi kena cover dengan pemikiran-pemikiran positif. Kita tak ada cara lain selain untuk cover dengan pemikiran-pemikiran positif. Sebab pemikiran inilah yang membawa kepada pergerakan dan perilaku yang baik. Gitulah. Yang kedua ialah kita kena harus saling berkomunikasi antara satu sama lain walaupun di rumah. Kita ada banyak medium-medium untuk berhubung. Kita ada WhatsApp, kita ada Instagram, kita ada Skype, kita ada Google Meet, kita ada Microsoft Team, kita ada macam-macam. Bukan kadang-kadang berhubung ni bukan untuk belajar je. Kadang-kadang kita macam video call kawan-kawan, cerita apa yang berlaku pada hari ni, cerita masalah kita. Sebab kalau kita pendam, benda tu takkan selesai. Faham tak? Kalau korang pendam, korang rasa macam akulah paling derita dalam dunia, tak ada siapa faham. Walaupun tak ada siapa faham, at least ada orang yang mendengar. Sekurang-kurangnya rasalah beban tu macam ringan sedikit. Okey, tapi janganlah cerita pula orang yang korang tahu memang annoying jawapan dia. Korang jangan cerita kat orang-orang yang korang percaya sajalah, okey? Tips yang ketiga. Okey, jauhkan diri sedikit dalam sosial media. Kita ada penghatian dalam sosial media kita. Kita ada Instagram, kita ada Twitter lah. Ni terutama dua ni lah, Instagram dan Twitter ni. Kita mesti selalu jumpa orang-orang yang macam keluarga bahagia. Kita akan jumpa suami isteri yang baik. Kita akan jumpa sweetnya OTP 24 jam, OTP 80 jam. Lepas tu screenshot post kan, I love you so much, ataupun from this to this ke apa benda. Semua benda tu membuat kita rasa macam, oh diriku sangat jauh daripada dunia. Aku sangat celaka, aku sangat sedih, aku sangat derita, aku sangat malang dalam dunia ini. Which is tak boleh berfikiran macam tu. Korang kena jauhkan diri daripada sosial media. Kalau korang rasa korang boleh overcome that feeling, okay je. Korang memang nampak macam simple, macam aku just jealous kat dia, tapi lama-lama korang akan blame diri korang kenapa korang tak boleh jadi macam ni. Lepas tu korang blame sekeliling korang, dan akhirnya korang akan jadi kesihatan mental yang macam, ya Allah, aku sangat derita, tolong aku, kenapa aku tak ada keluarga macam ni, kenapa aku tak ada pasangan macam ni. Which is bullshit. Yang keempat adalah, yang terakhir adalah menjaga ibadah kita dengan Tuhan. Dalam agama mengatakan bahawa benda paling penting adalah kesabaran. Kita kena banyak sabar. Bila kita sabar, cara untuk sabar tu kita kena berfikiran positif. Benda dia akan berkait-kait lah antara satu sama lain. Faham kan? Faham. Dan dalam agama kita diajarkan untuk melakukan 3 perkara kecil. 4.1 adalah dengan menjaga lidah dan tidak menyakitkan hati orang lain. Maksud dia macam kalau kita tak nak tersakiti, kita jangan sakitkan orang lain. Yang kedua adalah cuba untuk memahami orang lain. Kita try untuk memahami orang lain. Kalau kita tak faham orang lain, macam mana kita nak expect orang lain akan faham kita? Betul tak? Betul. Aku yakin betul. Yang isi 4.3 adalah kita harus saling tolong menolong antara satu sama lain. Kita tolong kawan kita tolong. Faham tak? Kita tolong dalam semua hal. Kalau kita mampu untuk menolong, kita tolong untuk meringankan beban antara satu sama lain. Amalkan banyak zikir, ingat pada Tuhan. Benda ni memang macam, kenapa kau ni kata tak, kesihatan mental ni tak patut kaitan dengan Tuhan? Kenapa nak kaitan dengan Tuhan? Bukan maksud aku itu. Maksud aku macam, okay, kita ada doktor, kita ada ini, kita ada itu, kita ada itu. Salah satu option itu, apa salahnya kita letakkan kembali kepada Tuhan kan? Okay, itu sahaja 4 tips untuk menjaga kesihatan mental during PKP ini. Itu sahaja daripada saya. Assalamualaikum.
Okay, thank you, Michelle. That was a very energetic video. After getting all our energy back from that video, I'd like to start with the second round. And just a little information. We might be a bit, we might go over time. So just need to put that out there, yeah? Okay, so I would like to start with round 2 with Prof again.
I'm here.
Yeah, okay.
Interesting video.
Yeah.
Very energetic, the second one.
Semangat dia tak boleh lawannya.
Tapi bagus, banyak tips dalam video tu tadi.
Okay, nak tanya Prof, lepas MCO ini tamat, kita masih lagi perlu menetapi dan patuh dengan SOP and the new normal. Jadi adakah hal ini akan memberi impak negatif kepada kesihatan mental seorang?
Okay. Memang kalau ikutkan dengan MCO dan COVID-19 ni, dia akan berterusan lah. We don't know how long it will last. I mean, perhaps probably another 18 months or 2 years or something like that. So we have to live with that, with the situations. Tiga bulan lepas kita telah, dalam bahasa psikologinya, kita telah di-conditioned to live in such a way. So-called, we use the term new norms atau norma-norma baru, di mana sebelum ni kita boleh berapat dengan kawan-kawan, kita boleh put our on the shoulder of your friend, our hand on the shoulder of friend. So sekarang ni dah tak boleh dah macam tu. Sebab terutama kalau kita pergi di tempat-tempat yang terbuka, kita tak tahu siapa kita encounter. Kita mungkin berjumpa dengan seorang yang ada kontak dengan orang yang ada COVID ni. Sebab COVID ni yang paling menakutkan, sebab dia boleh jadi tiada simptom, tiada tanda-tanda, tapi dia ada dalam badan kita. Terutamanya yang muda lah, macam dalam kumpulan audience semua yang dengar ni kan. Jadi dia ada dalam, tapi bila balik raya haji nanti, jumpa dengan parent dah umur, mungkin ada yang dah 60 kata, macam tu, parent dapat virus tu, dia pula yang dapat, yang pembawa tak dapat. Ini yang kita khawatir sekarang ni. Jadi kita culture ataupun kehidupan yang kita telah buat selama 3 bulan, dia sepatutnya menjadi sebahagian pada culture kita. It should be a culture to us lah. Maksudnya culture memakai mask. Kalau nampak kat public, orang tak pakai mask dekat tempat ramai, maksudnya ada 3-4 orang ke, dekat library ke, atau dekat kedai makan ke, kita boleh tegur lah. Macam kan yang kempen tak nak merokok pun, dia galakkan kita tegur orang yang tak mengikut saranan itu. Jadi kita boleh tegur ke, ataupun sebab saya nampak je lah trend manusia ni, walaupun kita dah berubah selama 3 bulan, tetapi macam over the weekend beli makanan berbaris sampai 60-70% orang tak pakai mask dah. Itu yang kita khawatirkan. Kalau kita leka, kita tak ambil kisah, benda tu akan menjadi teruk. Dan bila wabak ni jadi balik, mental health kita akan jadi lebih terganggu lah. Menjadi risau bila ada ahli keluarga kita yang jadi, ataupun kita sendiri yang ada terkena wabak ini. Jadi ini untuk kesihatan mental ni, kita walaupun langkah tu langkah untuk COVID sebenarnya, tapi dia membantu mengekalkan kesihatan mental kita. Maknanya kerisauan macam yang kita kata awal peringkat yang bahagian pertama tadi, simptom-simptom ini. Jadi kita kena sebaik yang boleh kita cuba elakkan dia merebak. Dari satu budaya basuh tangan yang kerap, itu pun kena diamalkan. Jadi bila kita amalkan berterusan, lama-lama jadi sebahagian diri kita. Kita tak akan stres bila perlu memakai mask, bila berjumpa dengan orang, kita ada distance dengan orang itu, sebab kita dah jadi kebiasaan kita. Jadi ini yang paling penting. Jangan kita tak endah, tiba-tiba satu kali tu kita kena buat macam tu sebab kita pergi ke klinik, tu jadi stres dah. Alamak, kena buat macam ni, kena buat macam tu. Jadi jadikan amalan yang baik ini berterusan dan jadikan macam safety first lah. Ini sekarang ni health first lah, maknanya kesihatan kita kena diprioritikan, kebersihan dan sebagainya. Dan akhirnya kita kena jaga kita, itu hashtag tu betul, sebab kita tak boleh expect law akan jaga kita sepanjang masa, sebab akhirnya kita, kawalan diri kita tu akan more sustainable, akan berterusan, sebab takkan selama-lamanya polis kena monitor kita, kelakuan kita dan sebagainya. Jadi kita kena kawal diri kita sendiri. Dan di universiti sendiri, macam yang kumpulan yang audience ni juga, most of you definitely will go to e-learning lah, for indefinite time. So kita akan macam ini, kita akan bersemuka di alam maya, dan one to one, face to face tu very minimal, sebab kita nak mengelakkan benda ni boleh merebak. Sebab macam saya kata tadi, konsep dia physical distancing mesti ada, tak boleh dalam confined space, tak boleh very close. Jadi kita kena adaptasi, dan ini yang masalahnya kadang-kadang mungkin social ataupun e-learning ni tak semuanya ada internet yang bagus. Jadi dia cepat burn out nanti. Sebab apa? Internet line slow lah, komputer pula RAM dia tak laju lah. Jadi bila kita dengar, jadi bila dia lecture jadi stres. Ini kadang-kadang saya anticipate lah dari segi e-learning ni, apabila kita banyak menggunakan platform internet ini, di mana punca stres tu mungkin boleh bertimbul di situ. Saya daripada itu, macam kalau kita tengok saja, boleh tengok apa tadi, email, kemudian tengok Facebook, kemudian kita ada apa, Microsoft Team ni, kemudian ataupun Google Meet ni, kemudian kita tengok apa lagi, buat assignment, words. Bayangkan berapa jam kita habis dekat situ saja depan laptop satu hari kalau bekerja dari rumah ke belajar dari rumah, sama saja. Jadi ingatlah, kena ambil take a break when you think it is too overwhelmed to you, dah terlebih dah tepu dah stres, dah macam berpinar mata tu, sebab kita ni depan ni pun ada radiation semua. Jadi take a break. Kalau kita perlu break setiap 45 minit lah kita ambil break. Kalau setiap sejam kita boleh tahan, atau 1,5 jam. Tapi jangan lama sangat. Saya rasa paling lama kita boleh berdepan berterusan pun sejam setengah macam tu. Lagi banyak break lagi bagus. Jangan kita nak marathon, nak siapkan kita buat berterusan sampai kita stres, kita tertekan. Ini saya rasa tip bila berdepan dengan laptop ni. Macam ada panel satu lagi tadi, dan daripada Befrienders tu amat dah list dah macam-macam simptom-simptom tu, dan kita jangan sampai jadi simptom ni baru kita nak ambil langkah, tetapi sebelum tu kita dah buat langkah-langkah untuk mencegah. Jadi tip depan dengan apa tu, gadget IT ni penting dalam keadaan zaman sekarang ni. Dan macam tadi kan, kalau kita letak makanan, kita tengok, kita makan, kita tengok, kita makan, lama-lama kita boleh jadi obese lah, makan pula makan apa, jajan ke macam tu. Jadi bila kita tu, kita jadi stres pula, tengok badan kita dah naik, stres pula sebab kita dah lama sangat dan kita tak keluar contoh. Jadi antara tipnya macam tadi, kita keluar jugalah, go to under the sun, keluar dari rumah, kata sekejap, sekarang ni boleh keluar, boleh riadah contohnya kan. Jangan kita maraton berjam-jam depan Twitter kita tengok, depan Instagram kita pergi Facebook, lepas tu kita buat assignment, semua depan laptop, depan desktop ni. Kena pula desktop tu memang perlahan pula lain lagi, kita stres. Jadi pandai-pandailah, jadilah pengguna yang bijak untuk make sure our mental health is maintained lah, in the good form lah basically.
Okay, jika nak tanya, let's say someone memang teruk sangat dia punya condition masa MCO ini. Is the clinic open to new patients? Or should they go find counselling elsewhere or so?
Okay, around this time actually klinik dah run balik seperti biasa. Actually during MCO itself, masa strictly March tu kan, the first 2 months, our the clinic in UMMC is still open. So emergency is still open. Tapi banyak orang fobia nak pergi ke emergency lah, takut terserempak dengan musuh tersembunyi ni tadi kan. Jadi kita notice pun orang makin sihat sebab penyakit-penyakit lain ni macam orang takut nak datang hospital. Kita pun notice macam tu, tapi kita tidak block untuk kes-kes emergency. Contohnya ada mental health crisis, suddenly tak boleh tidur ataupun rasa risau, tiba-tiba debar-debar contohnya kan, sebab macam panic attack tu, dia kena check sebab panic attack ni dia debar-debar, jantung laju, heart rate very fast, tapi mungkin ada masalah jantung, so kena pergi ke macam kecemasan kan, kena confirm. Jadi servis itu memang masih dibuka, dan sekarang pun di klinik kami pun dah buka, dan memang di PPM pun khususnya is returning back to normal. So in the new normal lah, new norm. So memang nak datang tu kena temperature, kena ada screening, tapi akhirnya boleh berjumpa dengan doktor. Jadi kita telah membuka balik untuk khususnya di pelajar di UM contohnya, memang boleh datang ke PPM jika ada masalah. Dan saya nasihatkan bila masalah sedikit pun dah jadi sensitif, maksudnya jangan tunggu dah lama dah teruk baru kita nak dapat rawatan. InsyaAllah kita akan terus mempunyai kesihatan mental yang sihat lah, macam tu.
InsyaAllah. Amin. Okay, so I'd like to shift back to Mr. Kenny Lim. Mr. Lim? Okay. I was also informed that you would like to tell us how to provide support to people who are in distress. So, what are the best ways to approach people who are going through a hard time in terms of their mental stability?
Okay, I think to begin with, right, we have to educate ourselves with information about mental health, about suicide prevention. What is the best thing to start with is actually to be able to recognize what are the symptoms and signs of someone who is struggling, some of the things that I've mentioned earlier, right? So if you notice that your friends or family members are showing some of the signs, as I mentioned earlier, then it's time to basically you try to reach out to them. Yeah, and it may not be easy because we don't actually talk about mental health issues openly, even with our friends. So how do we actually approach the person? What we need is basically, it actually has to come from the heart. That means you really need to be genuinely caring for that person or to show concern to that person. You can actually approach that person and basically say something like, hey, I noticed that you are struggling lately. It seems like you are not your normal self lately. Is there anything that's troubling you? Do you want to talk to me about it? So you encourage them to open up to you in a nice, gentle way, right? And then see what they say, yeah? If, let's say, for example, the person say, I'm not ready to talk, there's nothing wrong with me, okay? So what you can do is basically respect them, because not everyone wants to talk about their problems. And even though if they want to talk about their problems, they may choose who they want to talk to, right? And if they choose not to talk to you, don't take it personal, but respect that. Okay, and maybe what you can say is that, okay, I respect that, but in the future, if you feel like you need to talk, you want to talk to someone, I'm always here for you, right? So in the meantime, you may want to reach out to the befrienders, or there's pusat counseling in UM as well. So before you actually reach out to this person, maybe it's good to do some research yourself, like what are the helpline numbers, the number to your pusat counseling in UM, or how this person can actually reach out to professional help, like for example, how they can go to PPUM, that they need a surat rujukan, or they can go to pusat Mencari, things like that. Do research so that you have information to be able to help that person. Right? And then I think what is also important is to have empathy. Yeah, empathy is basically the ability for us to put ourselves in the other person's shoes and try to feel what that person is going through. Right? To have empathy, as mentioned by Prof earlier, empathetic listening. Yeah, to be able to just listen, because I also noticed that a lot of times when we listen, when we reach out to offer help, right, we don't actually just listen. A lot of times we want to give advice, we want to tell them what to do, we want to solve their problems, and all this is actually not very helpful. Because from my experience, 20 over years at the Befrienders, listening to people who are in distress, most of the time what they need is basically for you to be there and offer your ear for them, right? Be there, listen to them and accept them as they are. A lot of times you don't even have to tell them what to do. They would just tell you what they're going through, how they're feeling, and then that alone is actually very helpful. Because imagine this person may be struggling for a long period of time and has no one that they can open up to. And finally, they're able to talk to you. So that alone can be very, very helpful. So a lot of times we also feel like, I don't know how to help, right? If I reach out to this person, I don't know what to say. Yeah, the thing here is that it's not about what you have to say. It is being there and using your ear to listen to that person. Yeah, but it also doesn't mean that you just sit there and then listen and not say anything, right? That is like too passive lah. What the befrienders do and what we advocate and we teach others is to actually listen actively. So what is active listening? Active listening is basically you listen and then you also respond by saying things that is appropriate. For example, you ask questions that's relevant. You ask things like, for example, what is actually making you feel this way? Do you want to tell me more? Yeah, encourage that person to open up more. You give short response, for example, I see what you're going through, yeah? Things that is relevant, things that is focusing on them. Also try to, for example, reflect their feelings. So when they say something, after they've finished saying, you can actually respond and say things like, it sounds to me you are very angry at your best friend because he betrayed you, for example. So when you reflect feelings, right, it actually helps the person to become more aware of what is happening. Maybe this person is angry, but he or she is not aware of their own feelings. And that happens a lot of times, especially when it comes to uncomfortable feelings, yeah, because the way we are being brought up, our culture, is that you always just brush it aside, you know, feelings such as sadness, anger, especially, yeah, we are not encouraged to show our anger. You know, we should just sweep it under the carpet. But what happens if you sweep all this under the carpet? Does it go away? Do the feelings just go away like that? it doesn't, right? Because the feeling will actually come back to you later on. So what is important here is when we are supporting someone, we can actually reflect feelings and try to create this awareness in them, and also showing this person that, hey, I know that you're feeling angry in this situation. We are validating the feelings. Yeah, that we're telling this person that, hey, it's okay to feel angry at in situations like this. Yeah, but what is important is that you are allowed to express it. Yeah, so that is very important. Patience is very important as well, as mentioned in the video just now. Kesabaran is very important because when you're dealing with people who are depressed, for example, they may behave very negatively a lot of times, yeah. And for us, we may get turned away, we may get rejected. So in times like that, I think we need to be very patient and also understanding that, you know, this person is rejecting us not because they don't like us or they hate us. Yeah, it's because this person is struggling. It's because this person is having depression, and this person could not control what is going on in his mind, and that this person needs some time off, for example. So the patience is very important to basically support someone who is in distress. So what is really important here is read up about depression, read out about mental illness, so that you have a lot of information on hand. And when you are supporting someone, all these things may happen to you. So you then is in a better position to know that, you know, why is this happening? Why is this person rejecting me? So that, you know, you don't feel that bad yourself. Yeah. And having said all this, yeah, it's very important for you to also be aware of your own feelings. Okay. When we are supporting someone, there's always this danger that it will affect us, it will trigger us. There's this transference. What is happening to this person when we're trying to support this person, and then this person is telling us a story, and then this story reminds us of something negative that has happened to ourselves in the past. So then we get triggered. Yeah. So what happens then? So we have to be very careful here. If we find that whatever that's being shared is triggering to us, we have to get help ourselves. Yeah. And when you feel like you are not able to support this person, okay, what you can do is not only listening, you can basically tell this person that, hey, I am also struggling myself. I don't think I'm able to support you effectively. What about if we look for someone who's able to do that for you? Okay, we can do it together. We can look for this person together. We can go to the counseling center at the university together. We can check out the befrienders together, find out more information together. So basically, it's difficult for a person to reach out on their own. Yeah. So if they have someone who is able to accompany them, then it makes it easier for them. It makes it less scary for them to reach out, knowing that there is someone there with them. Yeah. So there's a lot of things actually you can do to support someone in terms of emotional support, physical support as well, being with that person. Sometimes when that person doesn't want to talk, but that person wants to do some activities, it's good. Like Prof mentioned just now, right? Don't just stay at home all the time. Go out, you know, under the sunlight. That can be very helpful as well. So you can encourage that person. Hey, do we want to go and do some exercise? Do we want to, you know, go for a jog? Or do we want to go for a meal together? You know, spend time together. Those are very helpful as well. Yeah.
Okay.
Right.
Thank you. That's a lot of good advice. And I'd actually want to know about the volunteers of befrienders. Is there a certain requirement to volunteer for befrienders? And if so, how do you become a volunteer?
Right. Thank you for the good question. Yeah, because I think I can recruit some of you. The only requirement is that you have to be 21 and above. That's the only requirement. Yang lain-lain tu ialah macam you are a warm person, you have good listening skills to begin with. But even if you don't have listening skills, we will try to teach you. Yeah. Some other things that can be very helpful. Someone who is empathetic, someone who is patient, someone who is warm and caring, and someone who genuinely wants to help people. Yeah. So what happens is that you will need to attend a preview. A preview is where we basically tell all the attendees what are the requirements, what are the commitments as a befriender, as a volunteer. Okay, so after the preview, if you feel like you still want and if you're still interested to join as a volunteer, you will need to attend a training session. We have 8 sessions, 8 sessions, 3.5 hours each, once every week. Yeah. So basically, the training is to help you gain more knowledge about mental health, about suicide, to basically share what is active listening, and also a lot of role plays because we want to prepare you before you go on the phone. So right now, the training is a physical one at our center. And with this pandemic, with this RMCO happening, right, everything is on hold for a while. So if you are interested, you can follow us on Facebook, on Twitter, and also on Instagram. We will be making announcement on those platforms. Yeah. Right.
Okay. That's good. So to all our attendees, if you are interested, do go to their Instagram and Facebook. And if you really want to help, then please do. We need a lot of people who understand mental health problems. Okay, so I'd like to put an end to round 2 because this is all the time that is allocated to this round. And I'd like to open up our Q&A session now. We have a set of questions. Both Mr. Kenny Lim and Prof. Madya, Dr. Mohsen. I will read out the questions and either one of you can answer them. Also a reminder, we might go into overtime if it's okay with the speaker. Okay. So the first question is from our Google Meet platform, and she asked, how do we make people understand BPD, bipolar, borderline personality disorder, and what can we do to make conservative parents believe that we have BPD? Prof or Mr. Lim would like to answer?
Yeah, I think it's a very interesting question, but I would like Prof to answer because, yeah, it has to do with BPD. I just want to maybe also let the participants know that befrienders are volunteers. Kami ni bukan professional, mental health professional. So what we have is trained volunteers. Kami dilatih untuk mendengar dan bukan psychiatrist macam Prof Mohsen. Yeah? So Prof, over to you.
Mr. Kenny, you have been giving very good advice earlier. I think it's very complimentary. Our service very important. BPD is a very tough, I would say, mental illness. I mean, if you were straight talking about borderline personality disorder, I guess many of our audience here, or public even, not really understand what is this mean by borderline personality. So it is, let me explain what is BPD. So borderline personality is a form of personality of a person, where manifested in the way that mainly, I would use the word the emotion, dysregulated emotion, the emotion easily to get disturbed, to get upset, appear to be very sensitive. So among the key features when talking about borderline personality disorder, it is when talking about disorder, it's already an extreme. When talking to me about disorder is already interruption of ordinary living, social well-being, and so on. So when talking about borderline, in essence, is first hard to take people emotion. Where they feel like even though someone, different people have different way of showing affection to another person. But this person with personality or borderline personality just now, they receive this emotion or affection not in the right way. So what is the way? Usually it's a negative way. They feel like even though this person have shown some affection, but the recipient, the person who have this problem, they don't feel being loved, they don't feel being appreciated, they don't feel being reciprocally given the emotion. So in short, it's like more negative emotion toward another person who he or she encountered. Of course, when they do like this, they feel like there's nothing inside their heart. Their emotion is empty, or their rasa macam tak boleh nak menghayati langsung emosi orang lain lah. So kekosongan lah, jiwa yang kosong lah, emptiness. So rasa jiwa ni tak ada kegembiraan, tiada keseronokan, tak ada orang rasa kasihan, sayang dekat kita dan sebagainya. Of course, the consequences daripada itu, when the emotion is empty, might as well I'm end my life. Dia mungkin tak mencuba, tetapi it's a better do that way. So ini cara ringkas lah saya bercerita pasal BPD ni. Dari segi kami pun amat mencabar. Ini pun dah berapa minit saya nak menjelaskan BPD ni. Jadi kalau kita berhadapan dengan seseorang yang ada masalah ini, kita kena betul-betul menjadi seorang yang saya kata neutral lah, pendengar itu sendiri. Ini cabaran. Memang saya setuju, good listener, memang itu kualiti kita nak, tapi not as simple as macam Mr. Kenny cakap tadi. Nak jadi seorang yang good listener is difficult. Duduk dengan pesakit, kita mendengar, kita tak perlu bercakap, tapi nak memahami pesakit is mula-mula saya balik rumah pun berjumpa 3-4 orang pesakit, saya dah stres dah. Saya sendiri dapat stres, walaupun depan pesakit kita tak boleh stres. Siapa nak tolong siapa at the end kan. Tapi ini mula-mula saya training lah. Saya kerja start 2002 sebagai psychiatrist ni. Tapi lama-kelamaan saya boleh absorb ni dan boleh kelolakan emosi saya sendiri. Ini penting nak jadi good listener ni juga. Jadi macam terutama berjumpa dengan seseorang yang ada borderline problem tadi, lagi cabaran. Jadi kita kena banyak bersabar, keyword dia dekat situ sebagai, saya cakap dari segi terapis tu, orang yang merawat tu. Dan kita tak boleh letak perspektif orang yang bercerita macam-macam masalah tu dari segi terapis tu sendiri. Kita tak boleh, kita kena detach dekat situ. Dan kita tak, macam kata tadi juga Mr. Kenny cakap, kita tak perlu komen apa yang perlu dibuat, tak perlu. Tapi kita mendengar dan kita endorse, acknowledge apa yang dia lalui itu adalah lebih penting. Dan sebab kalau kita mendengar hanya mungkin sekali tu dalam masa 20 minit, kita nak dengar, kita nak macam kita dah faham masalah tu, tak mungkin berlaku. Dia ambil masa dan dalam proses itu lama-kelamaan macam kami pun kadang-kadang 5-6 sesi baru kita boleh nak kata dia ada personality problem tadi pun. Keduanya baru dah 5-6 sesi baru kita boleh faham masalah tu. Jadi it's not a magic overnight we can solve that problem. Yang penting kalau dia rasa diri dah tak berguna, kita kena buat sesuatu mengurangkan rasa suicidal, nak rasa diri tidak dihargai dan sebagainya. Ini kita kena minimize masa kita jumpa. Tapi masalah punca tu kena ambil masa untuk nak fahami. Itu jawapan ringkas saya untuk BPD tu.
Kalau kita nak, if we want to make, let's say conservative parents, ditanya, how do we make conservative parents understand this kind of
So pada saya lah, conservative parents ni kadang-kadang yalah, kita pun ada encounter masalah ni bila pesakit masuk ke dalam ward kita bercakap. Conservative parent maksud saya di sini, satu daripadanya konservatif ni tak mempercayai rawatan moden lah. Itu satu pun kita boleh kata konservatif. Secondly, just very strictly on traditional healing. Contohnya ini budaya kita biasalah buatan orang lah, ini santau lah. Itu dah biasa dah, kami dah imin dah dengar. Saya boleh, sebelum orang bagi jawapan, mungkin saya boleh bagi jawapan apa yang akan diperkatakan. Jadi dalam konteks seperti ini, approach kita dari segi perawat ni, kita bukan confront masyarakat lah. Sebab dalam masyarakat kita ni memang dah banyak fikir macam itu. Susah lah kalau kita confront, lagi lah orang tu, parents tu tak nak datang cakap dengan kami. Lagi susah kita nak merawat. Sedangkan pesakit ni dah ada suicidal dan sebagainya. Kita tak nak lagi keluarga tak bagi sokongan, ataupun keluarga pula contradict dengan pesakit ni, lagilah disaster for us. So kita akan bercakap, kita mungkin akan membagi education lah, setakat mana mengikut kefahaman orang tu. Kita boleh cakap cukup pasal apa sistem dalam otak dan sebagainya pada orang mungkin tak sampai belajar sains macam tu. Tapi kita akan bercakap yang penting pesakit ini tidak ada rasa bunuh diri, tidak rasa kemurungan yang amat sangat, tidak ada kerisauan. Jadi kita akan perlahan membawa keluarga itu bercakap berkenaan dengan penyakit itu. Kita fahami, endorse apa kefahaman parents ataupun keluarga berkenaan dengan penyakit tu. Kita dengar, bukan kita kata mesti ya kan, tapi kita fahami. Kemudian barulah di situ kita kata, mungkin macam kita cakap tadi, empathetic listening, reflective listening, kemudian kita jadi neutral, non-judgmental. Elemen basic ni perlu digunakan. Jadi tak kira lah yang pendengar tu ada kefahaman macam mana, tapi kalau dia ada kualiti macam itu untuk jadi pendengar tadi, saya rasa sikit sebanyak dia membantu dalam masa acute tu. Sebab saya pun kadang cakap daripada parent ni, kita bukan nak suruh parent faham pasal psikologi ataupun nak memaham berkenaan dengan biochemical dalam otak. Kita tak expect pun orang lain untuk faham. Perawat tu lah kena faham kalau dari segi terapis macam saya ni. Jadi kita bagi ilmu, kefahaman, education secukupnya. Kadang-kadang lebih sangat pun menyebabkan orang risau jadi confused pun, itu kadang bahaya juga. Kadang-kadang terapis ni, rakan-rakan saya, bukan saya katalah, yang kadang-kadang saya pun macam itu. Kita selalu sedap sangat bercakap, kita bercakap pasal sains sangat, nanti orang pun jadi risau pula. Okay.
Okay, thank you. So the next question agak very interesting. I am anxious when I think about people exposing my or my family's identity and other stigma regarding COVID patients. So the person who asked this is a COVID patient, and she says that there's a general mentality that people who get the virus is at fault, and this is what causes her anxiety. Please provide some advice to overcome this.
Mr. Kenny, okay?
Okay. I think to overcome stigma, it's very difficult when we're talking about stigma from the masyarakat, ya. Sebab seluruh masyarakat tu memang susah lah. Tapi we can also see that the government has taken steps in basically educating the public that if you're a COVID patient, if you have recovered, memang tak akan how do I say, spread the illness, the virus itself. So here I think the person needs to basically be comfortable with herself first, that I am a recovered patient, that I will not spread the virus anymore, and that I will not stigmatize myself first. Okay, then slowly I think you start with people around you, maybe your family members, your neighbors, yeah, and share information with them that this is actually not going to happen. Basically, education. Show them, for example, information from KKM that describe about COVID-19. Yeah, I think it's a lot of hard work, and at the same time, you can also basically reach out for support for your own self. Yeah, if you feel like getting anxious about all this, and you feel that it is affecting your daily life, yeah, I think it's basically okay to reach out and get some help for yourself as well. Yeah.
Okay, thank you, Mr. Lim. Prof ada nak cakap apa-apa? Prof, mute.
Sila tekan button. Ini new norm lah, tapi tak stres sangat ya. Saya dengar tadi. So, COVID-19 ni pun bukan salah siapa-siapa pun yang dapat. Siapa-siapa pun boleh dapat. Kita naik LRT ke, kita naik bas ke, kita mungkin boleh dapat. Dapat tu pula mungkin positif tapi tak ada simptom. Ada yang ada simptom. Jadi macam demam, influenza, macam penyakit-penyakit lain lah juga. Jadi sebenarnya kalau ikut kefahamannya tiada. Cuma saya rasa sebab masyarakat telah ledakkan ni masalah COVID ni menyerang masyarakat. Impression dia COVID-19 kan, itu dia macam musuh lah kepada, sebenarnya musuhnya virus bukan orang yang dapat tu. Jadi kalau ikutkan, kita bukan saya nak kata samakan tapi mirip kepada macam denggi. Denggi pun dari segi perspektifnya lagi wabak yang lebih serius, kematiannya lagi tinggi. Tapi saya tak tahu pula orang boleh terima pula denggi ni seadanya kan. Dia sebab kita kena hidup dengan denggi, nampak macam mana dekat negara tropika dekat Malaysia ni kan. Jadi tak ada pula new normnya dekat denggi ni. Setiap hari kena bersihkan air bertakung, kena cari air kat belakang yang bertakung-takung bekas kosong semua. Tak ada pula. Tapi saya rasa kalau ikut realistically-nya, denggi ni lebih berbahaya daripada COVID-19 ni. Kematian disebabkan tinggi. Tapi itulah macam saya kata tadi, masa COVID datang denggi pun senyap sekejap. Tapi sekarang dah nak naik balik lah. So kita tak boleh salahkan COVID-19 kepada orang yang mengidapnya, mengadanya. Dan kita pun tak tahu kita boleh dapat ke tak dapat. Kita tak tahu sebab kalau tengok dalam banyak orang pun mungkin antibody dah ada tapi dia tak ada serangan ni penyakit tu sendiri. Jadi tak wajarlah kalau kita ataupun sama ada masyarakat keseluruhan yang external stigma ataupun self stigma pun tak perlu wujud dekat sini. Sebab batuk sesama semua orang boleh dapat. COVID-19 pun semua orang boleh dapat. Itu sajalah saya nak komen.
Okay, thank you. So we move to the next question.
Yeah.
Okay, Aisyah dia tanya how to have the courage to seek for help, because mungkin dia takut her condition is not serious ke apa. How do you get
Mr. Kenny Lim kot, sebab be friend is nice for people to seek help kan.
Okay, I think it's a very good question because memang ramai yang ada the fear to reach out for help, yeah, especially when it comes to mental health issues. So first thing here is basically to overcome your self-stigma, to have information to know that you are getting this not because of your own fault. Bukan salah sendiri, bukan sebab you lemah ataupun you pemalas. It's not a choice. Yeah, we have to know that mental illness also can happen to anyone. Yeah, so basically need to overcome that self-stigma. And then if you are not ready to, for example, go to a clinic to see a doctor first, yeah, you can always try by reaching out to a close friend that you can trust. Try to open up to this person, and if this person is able to accept you, maybe get this person to help you to weather the storm together. For example, if you want to go to the clinic, maybe ask this person to go with you. Yeah. Another thing that you can do is basically, because we do get calls from people who say, yang telefon and then they cakap, bila pergi jumpa dengan doktor tu tak tahu nak cakap macam mana, tak tahu macam mana nak luahkan, ataupun tak tahu macam mana nak explain apa yang salah dengan diri sendiri tu. So what you can do is also basically try it out lah. You call maybe the befrienders and then try it out, because with the befrienders it's not so threatening. It's with the phone, you're not face to face with that person. And also I can say safely that if you feel uncomfortable at any point of time when you're talking to the befrienders kan, you can just put down the phone. Okay, although memang we don't encourage that lah, tapi if you are really uncomfortable, you can actually do that. It's a choice. Yeah, so that's one thing you can do as well, to try it out, to test it out, because I think the more you talk about it, the more comfortable you are with yourself, and the more acceptance you are of your own condition as well. Yeah, so I think overcome your own self-stigma there, and then try to get support from people around you. If you don't have anyone who is supportive around you, it's okay, because there are many helplines out there that you can get support from. Yeah, and basically just know that mental illness is one type of illness. Is the only difference is that, you know, this is mental. It's not physical. It's not something that you can see. But then it is an illness, and it is an illness that needs to be treated and can be treated, right? Yeah.
Okay. Then a follow-up question: How do we build trust to reach out to someone who is close to us? Let's say, how do we know we can trust this person, so we can just tell them our problems?
Yeah, maybe I'll just answer first lah, yeah? Maybe Prof can add later. I think we do have some friends who are very close to us. Most of us do have that, yeah? But however close they are to us, we may not know how they would react if we tell them that, hey, I am depressed, I ada perasaan nak bunuh diri. So we don't know how they would react, especially when it comes to bunuh diri, because it's not widely spoken about in our society. Maybe in a very negative tone of a conversation when we mention about suicide, right? So what you can do is basically just test it out. If you're not comfortable, if you're not sure if this person is supportive enough, you can just basically test it out and bring up the topic of mental illness, bring up the topic of depression, of suicide, and see how this person react to it. Yeah, if this person says something that you think, hey, I'm comfortable with, and I think this person is empathy enough about all these issues, right? Then you can actually try to open up to that person. I think ask yourself, if you are not ready, if you don't feel safe to open up, you don't have to. You don't have to be forced to talk about your condition. You need to. It's your right, yeah. It's your right to feel comfortable, to feel safe in that environment to talk about your situation, yeah. So I think that's it. It's important for you to feel safe before you open up. Yeah.
Okay. Can I go to the next question? This is quite interesting as well. Diao, I'm sorry if I mispronounce your name. Diao says, I'm a kindergarten teacher. Since MCO, I have to do online class. I'm overstressed due to overtime working. Give me some advice.
Okay. Let me try to give some answer to this. As I mentioned, as much as the parents, who have to do online teaching or to do homework with the children, I think the teacher also, if working from home, as we faced over the past 3 months, working from home, sometimes it's no border between working at home and working the house chores and so on, and also have to perform the work. And the worst is sometimes it's extend to the at night, we have to do work at night. So this is the negative effect of the working from home. As even now, our email, we receive at night, without the MCO, or even before this, our culture email we receive middle of night, WhatsApp about work or study middle of night. So this is, I think, the main thing advice for this who asked the question, because first and foremost, you have to divide the time and do the work, perform the work accordingly. As I mentioned just now, if you need more break, you have to break. And of course, you have to time by 4 or 5, stop, because you're overexposed already with the computer. Because working in the natural environment, I mean face-to-face or go to the class, I think there's the feeling is different. Being a lecturer, they have different feeling compared to online, Yes, those who love to be isolated, to be working alone, yes, that will be good. But throughout, as I mentioned just now, in front of your laptop, in front of your smartphone for long hours, I don't think it's healthy, and it will cause you stress as well. So take a break, divide your works accordingly. Don't do things in marathon. If you think you should say no to work in the long hours, you have to say so, brave enough to say no, I mean, after you work for 3 hours, then another task, or to complete 6 tasks in the day, that too much for you, especially in front of the computer game. So you have to divide. Time management is important. Don't try to do things within beyond your capability to perform. Yes, that's my simple advice.
All right.
Can I just say something, Alia? I think it's very, very good advice that Prof have mentioned about learning to say no. I think a lot of us don't know how to say no, but it's important. That is a very important point. Students as well, learning to say no when it is appropriate. Yeah, that's just something that I want to add. Yeah. Thanks, Alia.
That's very true. Even I have difficulty in saying no. Okay, I like and off to the next question. Capital Z nak tanya, boleh tak terangkan perasaan saya yang anggap semua orang benci saya, even though kadang-kadang saya buat salah yang bagi orang lain kecil.
Doctor, you want to go and try to jawab soalan ni?
Okay, I will try my best. I think, okay, so basically, I don't know what's the origin that people hate someone lah. Bila orang membenci kita ni, tak tahu. Itu kadang-kadang, the worst is persepsi kita. Our own feeling. Ini kadang-kadang yang berlaku, saya rasa kebanyakan berlaku, tak ada orang yang, ada orang memang ada masalah lah, enemy semua tu sebab bergaduh apa-apa hal, tapi at the end of the day, majority yang ada perasaan ni kadang-kadang kita yang rasa terhadap diri kita, kita yang buat satu persepsi pada diri kita. Jadi kadang-kadang kita kena tengok lah, mungkin list out apa kualiti kita yang menyebabkan orang benci kepada kita. Sebab kadang-kadang bila kita nampak itu, kita akan okey lah, itu yang negatif lah akan keluar lah muncul. Mungkin tak nak tolong bila kawan tak ada duit ke, ataupun kita tak nak belanja kawan makan sekerap kawan yang lain ke, macam tu lah akan keluar. Ini kognitif CBT lah ni saya cakap, kita list out. Tapi sebenarnya sepatutnya kita akan confront balik fikiran kita yang macam itu kepada yang positif pula. What's good about yourself? Apa yang bagus berkenaan diri kita yang liked by person? Mungkin kita selalu ajar orang belajar subjek kita, share kan. Mungkin kita dalam grup tutorial yang active participant. Sebenarnya kalau kita listkan, berkemungkinan yang positif tu lagi banyak. Saya rasa itu naturally instinct sebagai manusia. Kita lihat kalau di dunia ni semua manusia banyak yang negatif, habislah kucak-kacir satu dunia ni kan. So setiap manusia tu dikurniakan kebanyakannya yang baik, ada banyak. Tapi sebagai manusia memang kita tak ada tak dapat elak kelemahan lah. Memang kita ada kekurangan, kesilapan semua manusia boleh melakukan keadaan itu. Tetapi bila kita ini kadang-kadang mungkin dalam konteks soalan ni ditanya ada krisis, ada masalah, ada tekanan yang berlebihan. Bila kita dalam keadaan macam itu, termasuklah macam orang yang ada kemurungan, kerisauan, dia akan nampak yang negatif lebih kepada yang positif tadi dalam keadaan spur of moment pada masa itu. Sebab itu teknik dia ialah macam saya kata list tadi, kita identify, orang tak suka, kita identify kenapa, lepas tu kita counter balik feeling tu. Tapi kita kena buat bukanlah sekali tak ada efektif sangat lah. Kalau kita habitually buat macam tu, kita question balik, kita analyse balik, dia akan jadi automatic. Next time kalau kita tengok, kita rasa orang tak suka, kita akan automatic, apa point dia nak benci aku, kerana apa, dan ini aku dah buat pada dia, ini dah apa yang aku tolong dekat dia. Jadi kita akan rasa adil pada diri kita jugalah akhirnya. Jadi kita mungkin lebih positif lah overall, itu paling penting.
Okay. This has something to do with how we help our friends. Liana tanya, how can I help my friends if they push me away, if they do not want my help? Jadi macam mana?
Mr. Kenny.
Okay. As I mentioned earlier, I think if they don't want our help, it's okay. As long as we have actually offered the help, don't feel bad about it. Don't basically focus on yourself and say that, oh, it's my fault, they don't like me, things like that. Tapi maybe put yourself in the other person's shoes and ask yourself, kenapa orang tu tak nak mendapatkan pertolongan dari kami. Okay, so maybe that person is not ready yet. Yeah, maybe that person is our best friend, tapi they are not comfortable to talk to us about that issue that they are facing. Okay, so we have to respect that. But tell this person that, or basically offer this person that these are the places that you can go to for help. Yeah, so it doesn't help if you force that person, and especially if you are like BFF, you feel like, oh, my BFF must tell me everything. If this person is struggling, must tell me the secret. Yeah, but it doesn't work that way really. Some people, I mean, we all have our own sets of secrets. Yeah, we are not an open book. We don't share everything. Even though when we open up about our problems, we don't say 100%. Yeah, so we have to actually respect that and accept the fact that, hey, this person is struggling, tapi this person doesn't want to talk to me. Okay, but that doesn't mean that you have to totally give up on this person. So once in a while, you can always check, hey, how are you right now? How are you with your issues? Are you getting help? You know, just basically try again. And if that person wants to talk this time, then it's good. Yeah. But if that person still doesn't want to talk, it's okay. But still try to show our concern. Sometimes it's about being with that person, walking with that person, not so much of wanting to know what's happening, trying to solve their problems, but just being there with them. It means a lot. Yeah.
Mm, yes, I agree with that as well. As long as we're with them, even the presence can help sometimes.
Correct. Yeah.
Okay. Next question. Um, Overthinking is one of the factors of mental illness. So how do we overcome overthinking?
Overthinking.
Yeah.
So yeah, sometimes we cannot avoid of taking so much thing in our life, especially depend on our roles, as a friend, family members, a member in the society as well. The thing is, too much thinking, I mean, unnecessary thing, I think it will what they call affect our mind, for example, become anxiety. So anxiety usually too much thinking, which is some of the thoughts that if you prioritize that, it's not a priority for you to think, at that moment. If you list out, you try to sit down and you list things make you worry, you can have probably 100 things in your list easily. But the thing is, which one you need to prioritize to have a deep thought, to really consider in depth. For example, that probably leave you with a 5-6 thing at that particular day, at that particular moment. So this is an issue about somebody overthinking. So you should perhaps prioritize of what come at that particular moment, what's priority at that moment, rather than try to put other things together. Because at the end of the day, if you overthinking, sometimes it's hard to find solution, because when you're thinking of a problem, you try to find solution. So if you cram so many things, you cannot find the solution. So that's one way. Secondly, perhaps no, this is about filtering. So like you write down what's your thinking, so this will also will help you and try to look the problem in more perspective, especially when you translate your thinking into writing. Okay. Yeah, I think that's what advice I can give lah.
Okay. Okay. Ada satu soalan ditanya, sekiranya seseorang itu merasa dia ada depression dan anxiety, apakah yang perlu dia lakukan? Tapi I think both speakers have already talked about it. Go out in the sun, just start working for a while.
Yeah, but yes, but as if you notice between Mr. Kenny and myself, we need to talk to someone, someone who actually reliable, not now talking even in the Facebook and so on, but we have to meet. The best is face to face, or at least you can see the facial expression of you, like and the intonation, how we speak, because sometimes if you just simply write, you don't know what's the tone you're talking, so it can open to be misconstrued by other people, and more negative and the sequelae from that. So that's why the campaign last time, we have the words let's talk, we need to talk, if we stress. That's the first step. And of course, when we talk, we need to have a listener who actually, as we mentioned, empathetic, reflective in nature, neutral in that way, So then beyond that, we're talking about more specific. It's about, for example, we're talking about problem solving, in dealing with the problem. So when we when looking at the problem, we should focus or deal it in such a way, in the problem solution manners, rather than mess up the thing. Sometimes we try to solve problem when we have at the what they call at the peak of our emotional problems. So we try to solve problem at that moment. Definitely have to suggest my patient even not to solve problem when you are very distressed, when you it's a bit of ease of your emotion, and you have spoken to someone. Sometimes when try to solve problem, we cannot see the real solution, because we see from our point of view. Other people probably see us as a 360 point. So they can suggest, not necessarily we obliged to follow, but can suggest other ways to solve the problem. So this is important thing about talking to someone as a first step when you distress, whether you are due to depressed or depression, or because of anxious, yeah.
Okay, thank you, Prof. Ni Nur Atika Razman tanya, how do we see mental health through policy or legislation dari sudut undang-undang?
Mental health dari sudut undang-undang.
How does it work in their favor or maybe in disadvantage, kalau Prof atau Mr. Kenny tahu?
Mental health undang-undang ni saya nak komen sikit lah dulu, sebab contohnya undang-undang, mungkin saya tak nampak perspektif beyond that, tapi saya rasa macam contohnya sekarang ni isu pasal percubaan bunuh diri is criminal kan. Jadi memang kerajaan Malaysia sekarang ni, saya pun ada terbincang dengan AG office hari tu, kita cuba nak bawa keluar. I think kerajaan Malaysia dalam progress, tapi sebab yalah, kerajaan bertukar-tukar ni pun tak tahu bila akan bertukar undang-undang ni, tapi hari tu dah ada dikuat very highly likely, I thought it's very soon about repeal of the 309 tu lah, yang percubaan bunuh diri tu. Tetapi beyond that, saya rasa undang-undang bukan saya kata satu planet yang berbeza daripada mental health, tetapi skop dia adalah sikit perbezaan. Sebab kalau ikut dari segi kesihatan mental ataupun perubatan pun, kita yalah ada undang-undang kan juga. Sebab contohnya MCO tu undang-undang lah, pendekatan kesihatan menggunakan undang-undang. Ada role di situ. Jadi saya pun mungkin salah pada yang saya kata dua planet yang berbeza. Tetapi saya rasa kalau sebut segi kesihatan mental health, contohnya konsep of confidentiality, kerahsiaan dalam kita bercakap, orang kita jumpa, orang kita rawat, atau lagi self autonomy. Self autonomy ni maknanya keputusan individu tu kita respect apa yang dia buat, as long dia dari segi mental ni, mental capacity-nya bagus. Okay. Confidentiality, autonomy, kemudian volunteer lah, maknanya kesukarelaan. Maknanya kalau dia nak dapat rawatan, dia sukarela dapat terapi dan sebagainya. Jadi ini essence lah. Jadi dalam konteks perawatan, perubatan, termasuklah kesihatan mental tadi. Jadi undang-undang ni of course, saya rasa kalau bayangkan kita tak ada undang-undang, negara kita akan chaotic, akan jadi huru-hara, tak ada kesamaan antara rakyat, antara orang dan sebagainya. Akhirnya orang miskin akan berperang dengan orang kaya, contoh yang paling simple lah. Jadi akan jadi kucing-kacir. Bila macam itu berlaku, saya rasa kesihatan mental pun disaster juga pada masa itu. Jadi itu kepentingan juga undang-undang dari segi kesihatan tadi atau kesihatan mental tadi. Jadi ini yang saya nampak boleh ulas lah berkenaan hubung kait antara dua itu. Ya.
Mr. Kenny ada komen?
No comment, but then I agree with what Prof said lah tentang 309 tu, iaitu sesiapa yang membuat cubaan membunuh diri boleh dimasukkan ke dalam penjara ataupun didenda atau kedua-duanya sekali. So it's a work in progress lah. I also realised because we were also invited to the discussion kan. Tapi as Prof mentioned, tak tahulah sekarang dia punya status macam mana. Tapi hopefully it gets to be done. It's something that I think needed to be done because with it removes a lot of stigma. In I think Southeast Asia, Singapore has already removed such a law. Yeah. So yeah.
Okay. So unfortunately, we have just one question left. The last question. Iqbal Hakim. He asked, how do we remove the feeling of pressing pause on life? pressing pause. I think he's talking about ending it. How to pause. How to remove the feeling of pushing pause on life.
That means how to stop or what? I don't know.
How to remove the feeling of wanting to take his life. If I see it properly.
Okay. Prof, you want to say something?
Mr. Kenny, befriender would be better to answer that.
Okay, maybe from our perspective, it's basically we believe that suicide is preventable. Bunuh diri ni sesuatu yang boleh dicegah. So what we always encourage people to do is basically to reach out whenever you're feeling suicidal. You don't have to be on your own. You don't have to suffer on your own, because there are people who cares for you. Although you may not be able to see it, and also in some cases, memang mereka tak ada siapa-siapa yang care for them. But if they don't have anyone, there's always helpline. There is always, doctors, for example, in the clinic who or nurses in the clinic who I think care enough to want you to be safe. Yeah. So I think what is important is to reach out and to talk about it. At the befrienders, when people call us, mereka yang ada perasaan nak bunuh diri tu kan, bukannya kita di befrienders ni, we don't actually give them advice or we don't tell them what to do. Basically what we do is we just listen. And most of the cases, lepas mereka luahkan perasaan mereka, mereka akan rasa lega. That alone is already helpful. Yeah, the perasaan nak bunuh diri tu masih ada lagi, tapi pada saat itu selepas mereka meluahkan perasaan, they feel like, I don't have to do it now. It's like you postpone it for a while. Yeah, it may come back to you. Then you need to get someone to talk again. So if you are really suicidal, if you are having depression, for example, calling the befrienders all the time basically is helpful, tapi it doesn't solve the problem. Okay, so in cases like that, mereka yang ada penyakit mental, for example, mereka boleh menghubungi befrienders untuk mendapatkan sokongan emosi, tapi pada masa yang sama mereka perlu berjumpa dengan doktor. Like they need to go and see prof to get treatment, to go into the recovery phase. So basically befrienders is sort of like a complimentary service to people who are struggling. We don't actually sembuhkan orang. Okay. Prof,
I just want to add a bit. We also see frequently, I mean, of course, in the worst scenario to our patient with mental illness. So we're talking about tendency or suicidal ideation, suicidal attempt, usually is at that particular moment. So you don't know what's going to happen tomorrow or the day after. So if the patient or the individual speak to someone about the difficulty, emotional difficulties, about distress and so on, usually the suicidal thought at that particular moment will de-escalate. And of course at the time we can offer help, and after that moment perhaps the person will look the problem in a different way, after ventilate the emotion to someone. So rightly, we, as mentioned earlier, they need to speak, and the listener is very important as well at that moment, especially when talking about suicide. So this should be non-judgmental, should be reflective listening, empathic listening, all this quality of listener is very important. So that's the first step. The next step, as mentioned just now, when we're talking suicide, there's no issue. In the PPM or any hospital, people can walk into the emergency department to seek help, to see a doctor. So if you think you cannot help, and many patients also come in such a way as well, they feel like family not the family doesn't help them, something like that, they come and seek help at the emergency department, and they will channel help in the hospital. And thanks God, alhamdulillah, like dekat PPM ni, bila dia keluar, keadaan tu lebih bagus lah, keadaan emosi, daripada masa mereka masuk masa ada krisis semua. Itu continuation daripada befrienders works lah, or we work hand in hand anyway. Very important. That's why saya tadi banyak suruh Mr. Kenny Lim, sebab dia really on the ground experience as well. Lebih bagus juga untuk dikongsi di sini. Yeah. Okay, itu saja.
Okay, thank you so much to both of the speakers. There's a question asking how to contact befrienders. If you the phone number and email address. Can we get it from Google or?
All right, we are quite active on Twitter, Instagram, and also Facebook. Yeah, so it's readily available there. Also, there are 9 befriender centers in the whole of Malaysia. Tapi the one in KL is the only one which is 24 hours. So on our website, there's also a list of all the contacts of all the centers. So basically all centers ada talian di KL 24 jam. If you don't feel comfortable talking on the phone, there's also WhatsApp service which is provided by 4 centers in Malaysia. And if you prefer to email, you can do it also. Tapi for KL Center, we are really overwhelmed with emails. One day, I think we get up to maybe 30 or 40 emails. So it takes time to respond to the emails. So I would advise you, if you really need to talk, call us. Yeah.
Okay, thank you so much. So that is the end of our talk and also the Q&A session. So thank you so much to our 2 speakers. And before we end this program, I would also like to announce the winners of our selfie contest. Yes, we did not forget about you. We opened up a selfie contest at the same time as the video contest. And there's a lot of participants who submitted their selfies. And we also decided to give consolation prizes to a few people, which are Azrizwan, Azmuddin, Cheesy or Chua, Shazani Takifa, Alindina, Nageswari 0103, and Nasrun Fadli. And the top 3 winners of our selfie competition, starting from the 3rd place is Michelle. Congratulations, Noor Inshiraf. That's a lovely selfie. Congrats. All right. And 2nd place is Faiz Matnoor. There he is. Congratulations, and it's a very nice pantun. Okay, and the champion for our selfie contest, and Michelle. Congratulations, Dafi Fida. You are the champion of our selfie contest. And thank you so much to everyone who participated. And I would also like to inform you that the consolation prizes are actually 10 ringgit for each person. So thank you so much to all the participants of this program, of the competitions, fellow lecturers, Prof. Madya, Dr. Hanafi, Prof. Madya Datim, Dr. Safia, our 2 speakers, Professor Madya, Dr. Musin, Mr. Kenny Lim. Thank you so much for spending time with us and giving us so much advice. And I would also like to thank our joint ventures once again, which are WAPTv.Malaysia, Dreamers Training Group, Youth Build Nation, KMUM FSSS, PKPIM UM, and Harmoni UM. Thank you so much to everyone for willing to be with us. And before we end this, I would also like to remind you that we have a feedback form that we will relay to the participants shortly through WhatsApp. Okay, let's end our program today by reciting Surah Al-As dan Tasbih Kafarah. Amin. Okay, beribuan terima kasih kepada semua penonton. Salap silap mohon dimaafi. So let's end the program today. Thank you very much. End the stigma. Reach out. Save yourself. Save us. Thank you. Bye. Take care.